Good morning, everybody. We're going to get started. Thanks for being here. Lyle Smith Graybill is my name. I work with United Way of Weld County as the collaborative applicant for the Northern Colorado Continuum of Care. We are recording the meeting so that it can be shared with those who aren't here for the PIT, the point in time count training for how to do the unsheltered surveying. So we have a few things. We're gonna do an overview that uh, Rachel Kirkland with Homeward Alliance is going to provide to us, and then she's going to do some training on the use of the survey tool. And then I'm just going to show the map that we're using for the different regions of the count and a few other items that will kind of help us understand the fullness of it. Many of us have done this count before, though, so it's not going to be all new information. But nevertheless, thank you for being part of this so that you can understand any changes that have been made from last year. And if you wouldn't mind, if you could put your name and organization in the chat, that would be really helpful for us to see who is able to make the training. So Rachel, really it's up to you to give us a start. If you wouldn't mind, if you can do the overview of the point in time count and then the training on the survey tool.
Sounds good. Thanks, Lyle. Can everyone see my screen in the PowerPoint presentation format, not like all the slides and stuff? You're just
That's
saying
the presentation format. Yep.
Perfect. Great. So yeah, like Lyle said, we're going to do a training on the 2025 point in time count. So in addition to putting your name in the chat, can folks go ahead and put in the chat whether this is your first time doing the point in time count, if you've done this 10 times, if you've done this 3 times, just so we can get an idea of who's in the room and what your experience is. A couple first timers, nice. We will have time for questions at the end, so we encourage you to ask them in this space so we can kind of talk through anything that comes up. And it sounds like we have a lot of experts in the room too, so thanks for doing the point in time count many years in a row and for being here again today. We appreciate it. So what is the point in time count? The point in time count is a federal requirement for every region in the United States. It's a snapshot of individuals experiencing homelessness for a single night, and you are required to conduct it in one of the last 10 days in January. We count both sheltered and unsheltered people experiencing homelessness. That's something unique to Northern Colorado. Other communities can opt into the unsheltered count every other year, but we choose to do it every year for consistency purposes. Once the data is collected, we aggregate that and report it to HUD. So we're giving HUD numbers like whole numbers of how many people were experiencing sheltered and unsheltered homelessness, how many individuals presented as Hispanic or Asian. We're not giving row level name data to HUD in this. So something to think about later on when we have questions, when questions may be coming up from individuals being surveyed. It influences resources available to our CoC, and it helps a little bit with trend analysis as well. And this year, the night of the count is January 28th, so it's a week from today. And if you wanted to see information on previous year's point in time counts, that it can be found on our website, on the NoCoCoc.org website. So our general strategy for capturing people experiencing unsheltered homelessness is a combination of getting data from HMIS and Survey 123, our manual data collection process. So with HMIS, we had a committee maybe 3-4 years ago that decided that we would be comfortable using an inferred method to count unsheltered populations from our HMIS system. There is a very comprehensive use of HMIS in the Northern Colorado CoC. Every emergency shelter is in HMIS, aside from shelters providing services to victims of domestic violence. So we're able to infer unsheltered status if somebody goes and checks into a day shelter the day after the night of the point in time count, and we can see that they were not in any emergency shelter on the night of the 28th, then we infer that they were sleeping somewhere unsheltered. So say, for example, somebody goes to the Murphy Center on the morning of the 29th, and they go there to take a shower, have breakfast, whatever. And that individual was not checked in for shelter anywhere in the CoC on the night of 28th, then we're going to infer that that person was sleeping in an unsheltered location. We understand that some people might be counted as unsheltered who maybe were sleeping in a motel that night or somewhere that technically wasn't unsheltered. We're aware of that, and we're willing. I think we basically are willing to reconcile that, right? Because there's going to be people who are unsheltered that maybe we don't capture, so it kind of evens out. And the committee that was established decided that this was okay, and we've communicated that to HUD as well. So that is our HMIS methodology. Survey 123 is manual, so we're asking people literally where did they sleep on the night of the 28th. You enter their information into a web-based form. Providers are encouraged to offer incentives when possible and applicable to get people to engage in this process. We have some special populations to be considered when going through the survey, and we'll kind of review that when we go through all the questions. But youth, where the head of household is 24 or under, there is a set of supplemental survey questions. And so this is just to try and better understand how the youth are experiencing homelessness in our community. If somebody is a veteran, there's a series of questions to ask if they're connected to services. If they're not, we ask for their information or have you as the outreach worker call Hunter Allen to get them connected to the veteran services. Anyone who responds yes to they're experiencing domestic violence, they're currently fleeing. There's a list, we have a list of all the DV providers in the respective regions and the CoC. Those are their hotlines, and this is information that you can provide to the individual as well. Okay. So I'm going to jump into the survey now. I put this QR code and the link here because you're welcome right now to go in and test this as we go through this. So if you want to follow along in your own browser, test using out the survey, put some fake data in there, whatever you want to do, you're welcome to do that right now. We actually encourage it. It helps us kind of test it. You'll see there's a memo at the top of the survey that says, do not use this to enter fake data after the 27th, because on the morning of the 28th, we're going to go in, delete all the fake data, and then have it ready to receive real data. And we ask to put in obvious fake data. So you can put in the name of the person that you're entering, you can put test, or you can name it's something very obviously outreach Fort Collins testing, so just try not to put in something that we might think oh, that looks like a real individual that is being surveyed. All right. Did everyone have a chance if they wanted to grab that link? Actually, I'll put it in the chat, just in case you didn't get it. Sorry, I'm slow. It's kind of hard to share your screen with the PowerPoint and everything. And even with two screens, I struggle.
Hey, Rachel.
Yes.
For Loveland Outreach, should we just survey on behalf of Summit Stone since we aren't actually listed?
Yeah, so Summit Stone is the agency, but when you put Summit Stone and you put Loveland as the city where the survey is being conducted, and then if the person is unsheltered, we'll know exactly who you guys are.
Okay, cool, thanks.
Okay, so this is the survey. This survey is highly dependent on conditional logic. So that just means the survey is going to start to have more questions appear as you fill out the question. So we'll put testing, survey, city where survey is being conducted. Is this person in a shelter? So yes or no. This is helping us understand if they're unsheltered or not. And then what is the name of the agency or shelter program you're surveying on behalf of? Are you able to survey this person? Yes or no? And then this is kind of like a prompt if you need support in how to communicate with the client. So we're conducting a survey to count people experiencing homelessness to provide better programs and services. Your participation is voluntary and your response to questions will not be shared with anyone outside of our team. I need to read each question all the way through. So just kind of like a precursor that you do technically need to read directly from the form to make sure the information is collected correctly. So once you get permission from the client, we want to also ask if they have already been surveyed to reduce duplication. So has any other volunteer or survey worker already asked you questions about where you stayed on January 28th? If they answer yes, the survey is going to stop. If they answer no, we're going to continue and see if we should survey them. So where did you sleep on Tuesday, January 28th? There's a list of options. If you select a situation like a motel hotel client paid, it's going to give you this response. They were not homeless on the night. This is an error, so I'll fix that. But they were not homeless on the night of the point in time count, so do not survey them. And that is a paid motel voucher or a motel or a hotel where the client paid for it. If they were in a motel or a hotel where a shelter paid for it, then you would survey them. Lisa, do you have a question?
Yeah. So generally I feel like our team is will kind of screen a little bit before we ask the questions. But if we get to this point and realize, oh, they weren't literally homeless, do we just kind of delete the data we've entered, or do we submit it with kind of that answer and it stops?
You can just stop the form, honestly. You don't have to.
So just clear it and say, thanks so much. That was great.
Exactly. Yeah.
Okay, thanks.
Thank you. So including yourself, how many adults are there in your household who are sleeping in the same location tonight? So this is, I think we saw a little bit of hiccups last year. So we are looking for multiple people in one survey if they're in a household together, right? If there was, 8 people camping together and they're technically all single adults and they don't identify as like one household, we don't want the answer to this to be 8, right? We want the answer to this to be 1 if they're a single individual. If there's a couple that you're surveying that couple is together, you can put 2 people in there as one household. But we don't, we're not trying to group individuals together in one survey. So just a little caveat there. If you put more than one person here, you're going to see that a second form will pop up. So you're going to have 2 forms to complete for this household. And then how many children under the age of 18 are in your household who are sleeping in the same location? This would be for any children that are under the guardianship of the head of household. So what is your first and what is your last name? This is important for helping us deduplicate data. We don't have a ton to go off of in the survey 123, so it's super important that we have as much information as possible to be able to deduplicate individuals. If the person is not comfortable with providing their name at all, we recommend asking for a little bit of information. See if you can get a little bit. So you could ask, can we have your first name and last initial? Would you be comfortable sharing that? Or can we have the first 3 letters of your first name and the first 3 letters of your last name? So there are a couple of variations that you can do to try and get some identifying information while making that person feel a little bit more comfortable about what they're providing to you. Again, this is also an opportunity for you to communicate that this information is not going anywhere beyond this. Like, right, we're collecting this information in surveys, the data is going to get aggregated and it will be submitted in that format. They're the only people that will see the data are the HMIS team. We are the only people who actually see the name data, but then we aggregate it and share it beyond that. Relationship to the head of household. For person one, this should always be self. They are the head of household. That is the first person that you are surveying. This is anything with the checkbox you'll see is a multi-select field. Have you ever served in the United States Armed Forces? If they say no, there's another question just for a double layer of trying to identify people who could qualify for veteran services, which is, were you ever called in active duty as a member of National Guard or reservist? If they answer yes, it's going to ask them to either of these questions. It's going to ask them if they're enrolled in VA services in Northern Colorado. If they're not, would you like to be contacted by a VA specialist to see what services you might qualify for? If they say yes, then we do need their contact information, or if they have contact information, and this information would be provided to a VA specialist. Their history of homelessness. So is this the first time you've experienced homelessness? Yes or no? And then how long have you currently been homeless? This is another conditional logic question. So if you, depending on how you answer this, there's going to be additional questions. And this is determining whether or not that person is chronically homeless. So you can see if you answer that they've been homeless 4 or more times in the last 3 years, it's trying to see if they've had 12 or more months of homelessness in the last 3 years, whether that's consecutive or if there's breaks in their homelessness. This section is to collect disabling conditions and barriers. So substance use disorder, mental health conditions, physical disabilities, chronic health conditions. And then this is a follow-up question. So do any of these conditions keep you from holding a job or living in stable housing? If you answer yes to this question, you do have to select which of these disabling conditions that they answered yes to are long-term for that person. These are additional disabling conditions. There's no question about whether or not they are long-term. They're inherently long-term. So if you answer yes to these, that's their final answer for that. Are you currently fleeing domestic violence? This is another one that if you say yes, it's going to ask if you would like additional resources to be put in contact with a DD provider in your community. It does ask for contact info. Again, there is that sheet that that slide where you can also offer resources to the client if they don't want to provide their contact info. So this is the youth supplemental survey. Since I put that the head of household is 22, those questions are going to pop up. If I change this to sorry for all the scrolling. If I change this to an age above 24, then those youth supplemental questions will go away. These questions are totally optional. We, again, are just trying to gather more information on how youth are experiencing homelessness in our community. I'm going to go through these relatively quickly. They're pretty self-explanatory. Once you finish the head of household, it does take you to the bottom of the survey, and you can just, it looks like you can just click submit, right? But if you try to click submit, it's going to give you an error, and it's going to redirect you back to the top of the survey to fill out the information for the second person. You'll notice that for the only person that it asks for chronic homelessness or history of homelessness information for is the head of household. So that's another important reason that we don't want people lumped together in the same household if they are not truly in the same household, right? Because it's going to bypass those questions. Chronic homeless determination is dependent on the head of household. So basically, if you have a family of 3, the head of household's history of homelessness determines the chronic homeless status for the entire family. So again, don't lump people together if they are not truly like a bonded household, right? Now that we have all of the information in, I'm just going to click submit. And then if you want to do another survey, you can just refresh your browser and the form will clear. Does anyone have any questions about before I move on to some additional slides?
I do, Rachel.
Yes.
It seems like, I mean, most of the questions for HMIS enrollment are built in here.
Mm-hmm.
Not everything, but most of it. Hypothetically, if we just did an HMIS enrollment, like if it was somebody, we're like, oh, this is the opportunity to do it, and then we enter their service, can we do all of that? And then of course we would do our CLS and service provided. Could we do that instead of doing the survey?
Yeah, that's a great question. So if you use HMIS, like Outreach Fort Collins, the Loveland Outreach team uses HMIS. If you use HMIS, we do use street outreach data to infer unsheltered homelessness as well. I should have mentioned this earlier. I forgot. But if you have someone enrolled in your outreach project and they have a CLS, anytime from the 28th to the 31st that indicates that they're sleeping in a place not meant for habitation, then we count them as unsheltered. So like Lisa said, if you approach somebody and your intention is to survey them for the point in time count, but it feels like an opportunity to engage them in your outreach services and it makes sense to do an HMIS intake there, this is essentially like almost the exact same thing as an HMIS intake. So if you put that information in HMIS instead, you don't have to do the survey.
So, and that would apply to anybody who's soft enrolled or hard enrolled, correct?
Well, so that's an Outreach Fort Collins term that.
Oh, okay.
But it's engaged or not engaged. So the date of engagement. Okay. So if they don't have a date of engagement, I'm sorry, then we don't use that information because
okay.
I'm sorry if you can hear my if there's no date of engagement, sorry. If there's no date of engagement in HMIS for that outreach enrollment, then we are assuming that person, no date of engagement means the person hasn't had an intake yet. And so that intake is what we're super reliant on to be able to capture that point in time data. And so the date of engagement, if it's completed, that tells us that we can use this information for point in time.
Cool, thanks.
Mm-hmm.
I have a question, Rachel, can you hear me?
Yes.
When we're surveying people in the Loveland area, if we're not counting motel, hotel, people who stayed in a motel, hotel the night before, but we are counting the people who are engaging in day services, would surveying near and around motels and hotels be a bad idea?
So that's actually not a bad idea because if they are self-paying, then they can be counted in the point in time count.
Okay.
You say they are, let's see.
Or at least turn your sound up then.
You would say that they're in a motel client paid. I'm sorry. Motel voucher paid. I said that totally wrong. If they're in the motel or hotel and that's because somebody else paid for it. So say for example, and Volunteers of America, I think they already put all this into HMIS, but they pay for motels for individuals and those people get counted in the point in time count. If there's like a random like person that is providing a subsidy, like to a random entity providing a subsidy to somebody to stay in a motel, we want to count that person too, right? And we can deduplicate. So if there is like Catholic Charities is giving out vouchers and they put that in their system, but you also collect that. We can, again, deduplicate that so we don't count that person twice, but it's better to try and capture them than not at all. I'm gonna bounce back to the PowerPoint. But folks can continue to ask questions in the chat or come off mute. So I just shared the online survey form process. There is an option, and I can connect with people individually if they want to use the app offline. So there's an option to use the app offline if you're going out to survey in places where you don't have Wi-Fi. You do have to download an application, and then once you return to Wi-Fi, you submit all the surveys that you completed. And then there's also the option of paper surveys. So you can use paper surveys to collect information. However, the CoC is not accepting paper surveys. So if you collect like 10 paper surveys, for example, you have to go into the online form and enter all of those paper surveys into the computer so that all of the data is consolidated. We haven't accepted paper surveys since maybe 2020, and it's made a huge positive impact on our experience consolidating the data. I do have a slide in here for incentives. Lyle, feel free to jump in to talk about this, but incentives are being offered to engage people in the process. We recommend that if you do have incentives to offer, they're offered up front, right? We're not bribing individuals, we're offering them up front. So if you are at a location where incentives are being provided, you tell the individual up front, hey, we have gift cards if you would like to participate in this survey, rather than a format where you're asking people to participate in the survey, and if they're hesitant, then you offer the incentives, right? We do it up front so that it's equitable, everybody gets access to an incentive, and there's no experience like, hey, why did he get an incentive and I didn't, situations like that, right? I don't know, Lyle, if you have anything to add on the incentives. I know that United Way of Will County is helping to get those distributed.
So I'll show a picture of them in a minute. The gift card that shows on the picture, it's a $5 King Soopers gift card. And I've connected with everybody for getting the incentives, I believe. But if I have not, if somebody's still curious about how I'm going to get these incentives, please let me know and I'll make sure that you get them.
We wanted to touch on a little bit of the best practices for surveying. So when approaching individuals, it's best to identify yourself, tell them what your intentions are. So just announce who you are before walking into an encampment. Hi, my name is Rachel. I'm from Homeward Alliance. I was wondering if you would be able to answer a few questions for me. I have gift cards if you're willing to participate in the survey. Be very upfront and transparent about why you're there. It's appropriate to tell them why you're surveying, right? So this information is going to be used to help us gain a better understanding of what our community's needs are. It's going to be kept confidential. It's not connected to anything. And then reduce the appearance of intimidation. So like try not to look like law enforcement, right? When you're approaching an encampment, like don't wear a belt with like a flashlight and like tools on it, I guess. I don't really know what makes you look like a cop, but just try not to. So also be empathetic. And I know that I'm like preaching to the choir right now because a lot of your street outreach workers, you know how to do this better than I do. But for anyone who's going out and canvassing and like surveying, and this is not like your typical day-to-day, it's super important that like we're acknowledging that there might be people in crisis that we're going out to survey, right? So there's going to be people that maybe are in need of services immediately, and it's not super appropriate to like ignore that or jump right into a survey if someone obviously needs help right in that moment, right? So asking them like if they're okay, if there's anything that you can provide to them in that moment, If there's something that is going on that is more pressing than a point in time survey, right? That you can help direct them to services instead of doing that survey, that's totally appropriate. And maybe they'll get surveyed later on or something. If the person says they've already done the survey, just thank them for participating and move on. We want people to have a good experience with this point in time survey because we do it every year. Or not only that, but because sometimes it might be that person's first interaction with a service provider, right? So if you're going out and surveying and there's somebody that you engage with who is newly homeless and they're camping or whatnot, and you're the first service provider that they've come in contact with, you're their first impression of our CoC, of our homelessness response system. And so that experience, like, we hope that it's positive for that person so that they might be willing to engage in additional services should they kind of venture out. And again, there's a lot of street outreach workers on the call, so I'm preaching to the choir. But if you're not a street outreach worker, just a couple of pointers. And honestly, if you are a street outreach worker on the call and you have anything to add here, like, please do come off mute and give additional tips and insight as to like what best practices are for approaching people. People might have questions, right? So people might have questions for you as you are surveying them. So like, why are you doing this? Again, I've talked about this, but we need an accurate count of people experiencing homelessness. We do this once a year. We need to know what to advocate for in terms of our community's needs. Information will be kept confidential. I can't stress that enough. And yeah, there's always if you don't want to answer this question, we can skip it while you're surveying someone. So you can put data not collected or client doesn't know, right, as or client doesn't know or client refused as the response. We ask that be offered at every question, anytime there's hesitation, right? So that's always an option.
Rachel, I have another question.
Yes.
Okay. Well, a couple questions. One, are we doing one incentive per person? So if we're like, here's the incentives we have, would you like to do the survey? They're like, I'd like socks. We give them socks. We start the survey.
I believe it's one incentive per person, but Lyle, feel free to clarify.
There's not a statement in the policy on how to do the PIT count on that. I mean, I think that it could be, I guess you could give people choices. We have hats, we have socks, we have gloves, we have the $5 gift card.
Cool.
So I suppose it'd be one, but I mean, I think part of it just depends upon the person's circumstance.
Okay.
Yep.
Additionally, if someone's like, I'll take the things you're offering, but I'm not going to do the survey, what do you do in that situation? Give them the things and not survey them if you're offering it first?
I would say so. Yeah, probably. If somebody
I feel like we kind of operated that way, like this, like you're talking to us, we will offer this to you. And there's some people that like just turn you down, like hi, my name is, and at that point we don't offer it. But like if we kind of have the conversation and they decline and they're aware of the incentive, like we didn't do that as conditional upon surveying.
Okay, cool. Thank you, Lisa. My other question was, which you might review this, Rachel, but with the shelter, I know Lyle had answered my email on this. So if we're taking CLSs from the 28th through the 31st, so the shelter will get this big amount of people. How to make sure that we're not duplicating, can one of our like first questions be how we typically do, where it's like, hey, where'd you sleep last night? And if they say shelter, the shelter, we immediately don't survey them, or what would be the best option? Because if they say, oh, I slept at LRC, then isn't their data already being captured?
Yeah, that's a good question. If they slept at the LRC, you don't need to survey them. We did last year a few where it was like it was like an outreach worker that put in a survey where the person was staying like at the cold weather shelter in Greeley or something. We automatically remove those from our data, like at the very beginning, essentially, of our deduplication process. So you don't have to go in and put that information in the survey.
Okay. So just for my understanding, we're trying to capture people who are not captured in the traditional system. Is that the goal?
Yeah, people who are sleeping outside, who are not staying in shelters or being
Gotcha.
captured. Yeah.
Okay, cool. Great. Thank you.
Yeah, and maybe it'd be helpful to share this. So last year, there were, during the count, there were 271 people that were counted overall, and then as unsheltered. And then the number of people that were actually found that weren't inferred homeless, because they had stayed at a shelter or something, uh, uh, or yeah, because they engaged in day services somewhere. The number that weren't inferred was 150 people. So between all of the two counties. So those are the people that'll be surveyed.
Yeah, thanks, Lyle. If folks don't have any more questions about the general surveying, I'm going to hand it over to Lyle to review the outreach map. But if others or if other questions come up while we're still on the call, you're welcome to, again, like, come off mute or put questions in the chat or whatnot. But yeah.
Thanks, Rachel. That was great. So before I forget to do it, as was mentioned, Hunter Allen with the VA is available to work with veterans that are found if they want to start, working on getting them into the VA's effort to address their homelessness and their homelessness. Hunter is available on the day of the surveying, so January 29, to work with you to get people connected like in real time if possible. And I just put his name and phone number and email address in the chat. So you could grab that if you'd like to. And also put that, I'm going to send a follow-up email, and I will include that in the follow-up email. This is the map that we're using for the count. And you can see here it's the two counties. So Weld County on the right and Larimer County on the left. And so different organizations, different people have taken on being lead organizations for the count. And those organizations are, and thank you very much for doing this. It worked really well, I think, in the past, and we've done it again this year. So thank you again for doing this. So I'll say the name of the people, the organizations, and also the areas they're covering. The green area is being covered by Hunter Allen Tatum Webb with Veterans Administration, and that's including Wellington, I-25, except for just a few exits, Berthoud, and Estes Park. And then the orange is Outreach Fort Collins with Lisa Dunworth and Fort Collins. And also there's a dark yellow section in there, if you were to drill down into it, that is being covered by the Hope team that Lisa is also supporting. Then City of Greeley is the purple area, and that's being covered by City of Greeley and Maria Hernandez and Rachel Pinkston. Then the blue area is Loveland. So Sandra Wright and Linda Nuss with Homeward Alliance, I've been working with them on that. And I know the Summit Stone staff, the outreach staff is working that area, the downtown area. And then the north part of Loveland and the east part of Loveland are going to be covered by Volunteers of America and Laura Mush and her colleague. The dark pink area is Fort Lupton, US 85, and Johnstown, Milliken. And that's going to be covered by Almost Home, led by Elizabeth Sustata and Delaney Coe. And then finally, the orange area is Carbon Valley and the I-76 corridor. And Corinne Crandall and the Weld County Department of Human Services staff are going to cover that. I'm going to send a link to this map out to you all as part of the follow-up email. And as you can see, it's just a Google map, so you can actually drill in and see all of the places that are pinpointed are places where we're going to focus, make sure to stop by. So you can see here for Fort Collins, a couple places downtown, out near I-25, And not all the places are pinpointed because you all know as doing outreach every day, you know where people are. So there are a few places pinpointed here, but certainly those aren't the only places to be sure and connect with people and to check. But just those are some places that in our orientations with the leadership, we've pointed out as places to give a look at. So like for instance, here in Fort Lupton, this is actually some feedback we got from Hope at Miracle House. Deb DeMille with Hope at Miracle House mentioned these places as good places to look. So you'll have access to this map. And of course, it's just a Google map. So if you wanted to, you could do a screenshot of it and print it off for your route. And that would be a guide for you as you're going out and about on January 29. Any questions about the map? Okay. Yeah, these are the point in time count incentives. As I mentioned, we have a couple different versions of hats in the incentives. There's some socks, also the $5 King Soopers gift card, some gloves, and hand warmers. Those are in bags that are being collected by different representatives of the lead agencies, and these will be passed out by them to you for your going out and about during the count. I'm going to also put my mobile number in the chat. And if you have any questions during the count that I can be helpful with, you could contact me. I'll have my phone on. I don't know if I'll be able to be perfectly helpful, but certainly reach out to me if there's something that you think that I could work with, and it may be that I direct you to your regional coordinator, or you might just call them first if they're your supervisor or your supervisor's supervisors. That might be the best resource for you at that moment. But I'm going to be available on the day of the surveying as well for any challenges that perhaps I could help address. So we're kind of to the time for any final questions. I especially invite any final questions from the regional coordinators or things you'd like to share for the count overall. And then if anyone else has any questions that we can address now while we're in the training. Okay, and then I'd also ask if Rachel, do you have anything else to share? Or I think that Christine Kopnick may be on the training, and if she has anything to share, please go ahead and do so.
So I know Lyle will be sending out materials after this meeting, so you'll have access to the slides and the link to the survey. And I can provide my contact information as well in case any questions come up as you're attempting to use the survey.
Okay, great. Well, thank you so much for doing this. It's so important for what we're doing through the NoCO CoC and regionally and together for the sake of our showing our unified effort. I think it's really great, the process that we have, and especially how we're covering all of the areas in the two counties. And I also very much thank you for the work that you do, how important it is. I would say some of the most important work on a day-to-day basis that is happening in northern Colorado for the sake of helping our neighbors. So thank you very much for doing that. And especially, for this particular participation in the point in time count. Great. Well, I hope you have a great rest of the day. And thank you for what you're doing to protect our neighbors right now in this very frigid time. Thanks so much. And I'll be in touch with a follow-up email. Feel free to be back in touch if there's anything that we can do. Take care.